So the need for healthcare reform, I think we can all agree, is urgent, and that American families cannot afford to wait. Let me just say that when union healthcare workers cannot afford the care that they deliver, and this is happening across our state, we have a crisis, as it is those very healthcare workers who provide all of us with the care that we receive, whether that's going into a clinic, going into the emergency room, having surgery, or even going into a long-term care facility or home. Members have also had to, unfortunately, go to the emergency room in the hospital where they work, and then ended up being harassed by a bill collector at the place where they work, the hospital that they work at. So we have many different stories like that, and I'm sure that you have heard across the state, but the delivery system is clearly breaking down. Healthcare workers are working longer hours, working with much less staff. Emergency rooms are overflowing, and then we see mental health units are being closed, and this all contributes to the crisis that we're in. It just makes it much more difficult for healthcare workers. I believe very strongly that healthcare reform will address the broken delivery system, and to me, it is either that we figure out healthcare reform, or our hospitals will really become the next auto industry. You know, what's going to happen when these hospitals, when these clinics are going bankrupt, as we see what's happening right now across our state. You can't afford something that's unsustainable, and that's clearly what we see. Let me just talk real quickly as well. She's scaring me. About a public option. And so we have SEIU, while we support healthcare reform in any and all forms, we do believe, as Congressman Ellison said, we cannot let the perfect get in the way of reform. I'm not quite sure you said it that way, but we believe a strong and immediate public health insurance option, something very robust, will give us all more choices and more control over our care, and really does and will ensure everyone has access to a quality plan. Now, obviously, we have to make sure that we understand fully what's in that public option, that it is not weak and watered down. But a strong public plan is equivalent or as close as we can get to a single-payer system and still keep Americans engaged and supportive of healthcare reform, and that we ultimately need access and affordability for every man, woman, and child in this country. And I will turn this over to Elliot.